there's been this bizarre thinking inculcated in several generations of Americans now that healthcare is different. Right. It's somehow different from other goods or services on the marketplace. It's unique in its provision. The market doesn't work. And number two is that you're entitled to it as a matter of being born onto God's earth. Well, by definition, you can't be entitled to the efforts or labor of another human. Right. That's not how morality works, for one. So think of all the people and sweat and toil that went into having a surgeon bring you a particular set of skills, and the development of the drugs that were used to anesthetize you or to heal your infection afterwards, whatever. I mean, these are marvels. And the idea that you have a right to those things, which represent the sweat and toil of countless people in a market, it is just, I don't know how to reconcile that. I disagree. And I've gone round and round with a lot of people who think that you do have a right to healthcare. So because we have this moronic idea that the market doesn't work somehow when it comes to medicine, and that you have a right to medicine for free, those are pretty big hurdles to overcome in terms of persuasion, political activism, whatever, lobbying, whatever it might be. So I think the better approach, the more guerrilla approach, where you use your time and energy and resources wisely, is to go out and just do things like DPC doctors are doing, like cash clinics are doing, like medical tourism is doing, like renegade pharmacies are doing. That's how we have to go after this thing, using the market and using entrepreneurship to fill in the cracks, which the government system still leaves.
Yeah, and I think I'm optimistic. There's been a resurgence or a restart maybe, because let's face it, like you're talking about with Dr. Ron Paul, 50 years ago, this is how medicine worked. And it was basically 1964 when Medicare came out. That's what really, really messed things up. And then, the government got involved highly into, medicine with Medicare and Medicaid. And of course, if you look at what happened right after that, the cost just went, and utilization went up because, there were certain procedures that were paid at a high rate. And so all of a sudden, people needed more of those procedures. I mean, a good example is nursing homes were basically non-existent in the United States. Not non-existent, but their growth over a 10-year period after Medicare was 700%. Not a surprise. Medicare and Medicaid pays for nursing homes. So all of a sudden, everybody needs a nursing home. And instead of the family taking care of their elderly parents or their sick family anymore, we wash our hands of it and let the government do it, kind of like what we've done with government schools, and the care is never going to be as good. It's just not. I mean, there are three things that we can get when we buy something, and that's basically price, quality, and service. And usually, in a free market, we'll tell people, well, you can get two of the three. But in healthcare, if you pay cash for services, you get all three, because the government system is that bad.
Well, when it comes to entrepreneurship, we all have responsibility as individuals to be as healthy as we can, to try not to consume all these healthcare resources, and especially given that the percentage of the population over 65 is set to double between now and 2050 in this country. So a lot of, it's going to be an aging, graying population. I consider myself in that group, and so. We have to not only avail ourselves of the market, but we also have to take responsibility, I think, for our own health, and try not to need too much healthcare. Because, as you said, the market exploded when you made it free. All of a sudden, people find all kinds of reasons to go to the doctor, and I think we're probably over-doctored in this country. In other words, there's probably too many doctors treating trifling things and maybe too few doing the really important work.
I agree with you 100%. And, it's basically economics. It comes down to economics. When, a diabetic patient, for instance, Medicare will pay for them to get a med check every month. I'm just using an example. I don't know if that's exactly true, but well, if that's the case, whether they need to be seen or not, those clinics that take government money, they're good at saying, well, you need to come in next month and next month and next month. And but when you look at the overall health of our society, it's not working. We're not keeping people healthy, that's for sure.